Welcome back to San Diego People. I'm Lauren Finney. With 1 in 4 people in the United States being affected by heart disease, changing aspects of your life can reduce the risks. Here to talk more about the risks and lifestyle changes is Dr. Karim El-Sherief and 2 of his patients, Mike and Liz Fleming. Thank you all so much for being here this morning. Mike and Liz, you both have a very unique story, and I want to get to that in a second. But Dr. El-Sherief, I'll start with you. Tell us a little bit about the biggest factors in preventing heart disease.
You guys touched on in the last segment. I thought it was a wonderful segment, and it's really about stuff we do naturally, staying active, eating healthy. It's really interesting. You know, nowadays, let's say we go to a movie theater, and you want to get a small popcorn. They tell you, there's no small popcorn. Popcorns are large. The Coke's large, but we can always make conscious decisions, like bring our own water. And stuff like when you're at your workplace, it doesn't always mean you have to always go to a gym and stay active. You can, be at your workplace, take the stairs, do things that are natural, and just staying active, eating healthy, making good decisions cumulatively decrease our risk of heart disease. Other things like stress, avoiding stress in your life.
Which, who's able to do that?
It's tough,
right?
You're right. I mean, I won't lie. Avoiding stress is sometimes almost impossible, but it's about coping with stress. They say being around loved ones decreases your stress. And, doing such things as going out and enjoying a great weekend with family or friends. Just being active is really goals that I try to promote for my patients.
Yeah. And it kind of brings in how we restart a new healthy lifestyle, especially after we've been affected like a major event, like a heart attack or a stroke, which kind of leads me, Mike and Liz, to your story. Mike, you've had 3 heart attacks. Can you tell us a little bit about, briefly, your health history and where you are now?
Well, I thought I was a pretty healthy guy, but self-impressions aren't always accurate. The heart attacks were a complete surprise. They probably shouldn't have been, because my father died at a young age from a heart attack. But
so your first heart attack was 9 years ago, but more recently, 2 years ago, you had a heart attack. And Dr. El-Sherief, you ended up putting in more stents in.
Yeah, so we put in more stents, and actually we were lucky to get Michael at the right timing. He had symptoms. He embraced his symptoms. He came to the emergency room quite quickly. We were able to rush him into what is called the cardiac cath lab. We found that some of his prior stents had built up plaque and clot. We were able to suck it out and put actually 3 more stents, which cumulatively gave him 9 stents. But I think what's really amazing about the picture is kind of what happened afterwards, is that afterwards Mike embraced that, you know what, I'm even going to make even more lifestyle changes. He enrolled in our cardiac rehabilitation program, and I'd like to give a shout out to our cardiac rehab program, to the nursing staff, to everybody involved, because it truly is one of the jewels and gems of Tri-City. And it allowed Mike to rehabilitate, and rehabilitate with confidence. And at the same time, he's turned that into maintenance. He's one of our maintenance patients, which means he's graduated from cardiac rehab, and he still makes a conscious decision to show up weekly, stay active, exercise, and also be an example for everyone else. So it's wonderful.
And having Liz as your wife, Liz, you're a nurse, but you're also dealing with heart disease, right?
I have coronary artery disease myself, and family history. Dad died young, mom's diabetic, and she's had heart disease also. And I'm the owner of a few new stents myself, not recent ones. Dr. El-Sherief didn't put those in, but I'm very active as well. I'm American Heart Training Center coordinator at Tri-City, and we teach CPR classes, and I take the stairs and ride the exercise bike and take walks out in the parking lot frequently as I can, so try to stay active.
What other kinds of lifestyle changes have the 2 of you made at home to really keep your risk as low as it can be?
Well, we make dinner at home most of the time. It's very difficult to eat out and go to a restaurant and try to see, what did they put into the food. If you're making your own meals, you know what you put into the food, and you know what's there and the ingredients, so you can make better choices that way. That's probably the big one. And then being active, we own a good piece of property, and walking around the property a lot, and with the dogs and that kind of thing.
You mentioned symptoms that Mike came in. He recognized some of the symptoms he was having with that heart attack. Can you talk about some of the symptoms and how they might be different for men and women?
Perfect. I think that's a great talking point. What I always tell people is utilize your inner Jiminy Cricket. I think most of us remember Jiminy Cricket. And anytime you feel something is off, especially when you're exerting yourself, so anytime you're exerting yourself and you get any type of upper body discomfort, a lot of times we always ask chest pain, pain. You'll ask a patient, do you have chest pain? They say, I don't have pain, but I've got this little ache over here. So a lot of times it's just embracing that, hey, something's off. We talked about shortness of breath, right? Sometimes, especially in diabetics, they don't have chest pain. So a lot of times it could just be, that walk I used to do up the hill, I'm a little more short of breath. I used to be able to do that, but I feel a little winded now. And especially in women, I think Jennifer touched upon this earlier, it isn't always the elephant sitting upon your chest. Women are very known to have jaw pain, ear pain, shortness of breath, arm pain. So again, any type of discomfort related to exercise that just doesn't feel right, talk to your doctor about it. What I tell people, my favorite thing about what I do is empowering patients, and at the same time reassuring patients. So even if you go in and everything's okay, it's better to ask, it's better to talk about it and be reassured. Then sadly, a lot of people wait, and they wait too long, and sometimes it can be fatal.
Mike and Liz, was there anything that really, because your journey has been for quite a few years now, was there anything in the beginning that you remember that now you talk to people about who are maybe getting older or starting to think, gosh, I really haven't had a physical lately, I'm sure you talk to your friends about it and getting checked.
It's extremely important to see your physician, and as Dr. El-Sherief said, as women we see things and have experiences that are very different than men. I had shortness of breath and headache, a funny kind of strange headache, and some back pain that caused me to initially go to my cardiologist. Family history is very, very important. Is history. If you've got that, you have got to take care of it and get on the medications and stay on your medication regime. When I first met Mike, I heard his family history and I immediately put him on an aspirin. And he was told that that's what saved him the first time when he had his first heart attack, that I had put him on aspirin.
Wow. Yeah. So now you know you just need to listen to your wife at all times, right?
Don't self-diagnose. Go see your doctor.
Happy wife, happy life.
There you go. It's an important role. Mike, how are things now? How are you living your life? And obviously you're doing what you're supposed to be doing and going to the proper management classes, which is good.
I can't get away with anything because I've got two people watching me.
That's a good thing.
Well, I've made a few small changes. Probably the biggest is that as Dr. El-Sherief mentioned, I go through the maintenance program at the Tri-City Wellness Center, and it's a religion to me now. 3 times a week, I've got the treadmill cranked up all the way to the max, and I just chug along until I'm dripping wet with perspiration. I feel great when I'm done. It's a good self-measurement tool for me. After I get done with a workout like that, I know my body well enough now that if I feel good at the end of that, everything is A-OK.
There were 2 things that you had mentioned on here as tips to preventing heart disease and managing that stress level that we all struggle with. But 2 things that I thought were interesting that you don't hear a lot. But in order to reduce stress, one of them was to live in a quiet neighborhood, which is surprising. And also another challenging one is to get the right amount of sleep. Can you talk about those 2 things?
Sure. And it all comes down to release of stress hormones. So if you're living in a quiet neighborhood, you're allowed to sleep. What we recommend is greater than 8 hours of sleep. There is some studies saying less than 6 hours of sleep through the night could put you at a greater risk for heart disease. So what I tell my patients is more importantly is get good amount of sleep. And when you're at home, have good sleep habits. I think that's something we never talk about. So sleep habits involved making sure that you're not necessarily reading a long book in bed before you get to sleep or watching TV in bed, because a lot of times that can disturb your sleep patterns. Other things in that we're bringing up sleep that I think is very relevant is something called sleep apnea. It kind of relates to heart disease, is if you've got a partner that you realize is snoring, might necessarily lose their breath while they're sleeping or become what is called apneic, make sure you let your partner know that and they can discuss that with their physician. It's another part of kind of making sure we take the appropriate steps to evaluate kind of what could possibly be hurting our heart.
Well, as a new mom, I am going to take that as a tip to get more sleep.
Yes.
But Dr. El-Sherief, Liz, Mike,
you.
thank you all for being here this morning and sharing your stories, especially. Really
you so
appreciate
much.
it.
Thank you so much.
Well, still ahead on San Diego People, we'll talk with a dietitian who will share some tips to help keep your heart healthy. We'll be right back. Stay with us.